Hello, and thank you for joining today's webinar. We are ready to begin. Today's webinar is eligible for 1 contact hour. Sigma Theta Tau International Honor Society of Nursing is accredited as a provider of nursing continuing professional development by the American Nurses Credentialing Center's Commission on Accreditation. The speakers and planning committee members have disclosed no conflicts of interest. To receive contact hours for this CPD session, participants are required to attend the webinar and complete the evaluation form, which will be emailed to all attendees approximately 1 week after the webinar. This webinar is being recorded and will be available via the Sigma repository within a few business days of recording. Following the presentations, we will have time for a question and answer session. You'll see on your GoToWebinar control panel that you can send a message through the questions feature. This is where you can type in any question you'd like to pose to the presenters. Be sure to hit send so the message makes it to us. We would like to thank our speakers for sharing their expertise with us today. Our speakers are Amy Varley and Sarah Fung. Sarah received her Bachelor's of Science in Nursing from Western University and her Master's of Nursing from the University of Toronto. She is an international board-certified lactation consultant and a certified associate in project management. She has been practicing as a registered nurse since 2007. Her expertise is in maternal child health with clinical experience in obstetrics and the NICU. She has worked in both academic and community hospitals and home health as a bedside nurse, educator, advanced practice nurse, and professional practice specialist. In addition to working full-time, she also has another of 2, which is a resume writer, an interview coach, and a podcaster. Sarah is passionate about issues such as bullying and incivility, diversity and inclusion, and helping nurses find their career paths in the profession with so many opportunities. Amy received her bachelor's degree from the University of New Brunswick in nursing and a master's degree in nursing from the University of Toronto. Amy also completed a collaborative master's degree program with the Dalla Lana School of Public Health at the University of Toronto in women's health. Amy is a dynamic speaker, advocate, and activist for nursing as a profession, mental health, health equity, women's health, and women's rights. Amy's master's degree focused on mental health of the postpartum women in transgender medicine. Amy has worked in many roles: labor and delivery nurse, maternal child nurse, educator, professional practice clinician, college and university faculty, and in quality improvement. Amy is passionate about helping others find their voice. Issues such as harassment, bullying, and gender discrimination have no place in healthcare. We must hold organizations to a higher standard and hold them accountable for creating spaces where this fear and inequality is rampant. It's time to fight for change and to speak our truths. Go ahead, ladies.
Hi, everyone. Thank you so much for joining us today. We're honored to be here. Thank you so much, Sigma Nursing, for reaching out to us and allowing us to share our stories and experiences with you and everyone at home viewing or wherever you might be viewing. So we're excited to be here. Can you flip to the next slide? All right, so today we're talking about it's okay to not be okay in mental health. So we're going to just quickly go over our learning outcomes. So the first one is we're going to discuss the pre-pandemic levels of burnout and mental health in nursing.
We also want to recognize the profound impact the pandemic has had on nurses' mental health before and during the pandemic.
We also want to talk about understanding the roles that organizations, employees' mental health have to play into this entire picture.
And we want to identify some tangible takeaways, how you can advocate for better mental health supports. So we're going to just start with some introductions. Thank you, Sigma Nursing, for an amazing introduction. We all sound so professional, but we all started from somewhere. And I think that's the thing with nursing. It's a very dynamic profession. I always say that there aren't too many professions where you can be part of someone's best day and worst day of their life all in the same day. So as Megan said, I am a nurse. I've been a nurse for 14 years now. I've worked in a variety of different settings, so acute care, whether it be teaching or community hospitals. I've worked as a bedside nurse, as an educator. I've worked a little bit in research, and I've worked in nursing leadership as a clinical nurse specialist, as well as a professional practice clinician, and now most recently an advocate and a podcaster.
And myself, my name is Amy Archibald Farley. I have an eclectic background as well. A lot of the work that I've done has been surrounded in terms of maternal newborn health, but I've also worked in education. I've been an educator. I've been a professional practice clinician. I am now in quality improvement, working in the emergency department and overseeing infection control. So that was a huge eye-opening experience, especially during a global pandemic. And I mean, the other piece is that we are podcasters. So honestly, the story is crazy how we kind of got into it. We'll touch on it a little bit more in some of the slides to come. But I wanted just to talk about just our journey into becoming podcasters and advocating. We actually both had our own mental health challenges and our own mental health experiences, in which we'll kind of discuss coming up in the next video. But the reason we started to have a podcast is because we want to share our own voice, our own experience, and also to lift other people's experiences up. Being in the profession of nursing, one of the things that we've been asked before is like, name a famous nurse. Can you name a famous nurse? And most people say Florence Nightingale. Why are there more nurses not in media? We need to speak up. We need to, be empowered to have a platform and to, show the world what nursing really looks like. So join us in the next video as we talk about our own experiences through CTV W5's The Burden of Care. Next slide, please. So I think you just have to click play. Oh, there we go.
Wow. Amy Varley and Sarah Fung have been pushed to their limits. They're both registered nurses in Ontario. They host a weekly show called The Gritty Nurse Podcast.
Test. Check.
They started it after their own job-related struggles with mental health.
Why does this keep happening in nursing?
To talk about what most healthcare professionals don't want to say out loud. You started this podcast to break a culture of silence.
Yeah.
What does that mean, Amy?
For me, it's so hugely important not to be silent. I need to let others be able to see that it's okay to not be okay. And it doesn't make you weak to say, I have mental health struggles or I have mental health challenges.
What is it like being a nurse right now in the pandemic?
The last year has been really exhausting. It's been traumatizing. It's been taxing on nurses.
You used the word traumatizing. Mm-hmm. Do you feel that there's trauma after this year?
I think most nurses, if you talk to them, are suffering from some kind of post-traumatic stress disorder. Like, I was talking to a nurse recently who said that in the last 2 months, she's seen more death than she has in the last 10 years of her career. So this is not an exaggeration to say that many nurses are traumatized and continue to be traumatized by this pandemic.
The Gritty Nurses also reported on the suicide of Ontario nurse Stephanie Van Wyn. Stephanie's family has not spoken about the circumstances of her death, but the Gritty Nurses say her loss speaks to a problematic culture in nursing.
I think this really rocked the nursing community because for the first time it was like, yes, this is tangible. This is what we've been saying all along. And now this really young nurse has taken her life. And more recently, there was another nurse who took her life. These are really the canaries in the coal mine that we are crying out for help, and we don't feel like anyone is helping us.
To ensure nurses can mentally push through this pandemic, Amy and Sarah are advocating for universal paid sick days.
It just speaks to the work culture and what you are getting yourself into.
Especially for nurses that are part-time or on contract.
If you give nurses the adequate amount of time they need to recover, whether it's physically or mentally, they can come back to work ready to work and healthy. Whereas if they just stick it out and work while they're sick, they may end up exacerbating whatever issue they have.
They also say nurses on the front lines need more money for mental health services now.
Some organizations have as little as $200. That's not going to get you anywhere. Starbucks Canada is giving their employees, even their part-time employees, up to $5,000 for mental health benefits. We work in hospitals. Why is there so much variation? We just need to do the right thing. Like, mental health is healthcare.
While some advocate for services,
So that was just a little segue into some of the topics we wanted to discuss today. And that clip did mention suicide amongst nurses. And we did pull some stats from April of 2021 from the Journal of American Medical Association. And it finds that suicide rates among nurses exceed those of the general public, and that female nurses in particular are at twice the risk for suicide compared with women in the general population. So we really need to open the conversation to discussing nurse suicide and mental health. Next slide. So we wanted to start with some participation from the audience. We want to know where you are joining us from today. So you can see at the top, if you go to www.menti.com and use the code at the top, which is 8461-1252, and just let us know where you're joining from today. We'll give everyone a minute to do this. If you aren't able to access the website, you can also type into the chat, which is going to be monitored. Just want to know where everyone is from.
We have somebody from Logan, Utah. How exciting. Jamaica, Canada. Little Waterloo, Iowa.
Cool.
Amazing. So lots of people dialing in from North America. I don't know if we mentioned, Amy and I are from Ontario, Canada. We're from the Greater Toronto area.
We also have people from New York, California, Ireland. Those are exciting.
Wow, that is really exciting. That's really cool.
I think Ireland wins the award so far for the farthest away from us.
That's for sure, yeah.
Oh, and it looks like somebody today also went to University of Western.
Cool.
All right, very good.
Okay, and then we just want to do another poll with everyone. So now that you have gone to the menti.com website, we want to know in one word, if you could just describe in one word how you've been feeling over the past 17, now 18 months. You can type that into the box and you'll see that the words are going to come up in real time. The word that is the most common will show up in bigger font than the less common words.
Yeah, right now we're seeing words like overwhelmed, stressed, discouraged, done, frustrated, blah, down, sad, confused. I mean, these are all feelings that we're all having as well. We'll kind of keep waiting to see some other ones as well. Burnt out, frustrated, we hear you.
Mm-hmm.
Major anxiety, absolutely.
This has been us as well, so we totally appreciate your honest feedback.
Exhausted, that's definitely been the pulse too, just overexhausted. Thank you guys so much for participating in that word thought. Like, we feel exactly the same way that you guys are feeling, and that means that it's not just you that's feeling that way. It's probably a number of people who are feeling this way. And we want to say that it's normal during this time, this unprecedented time, these feelings that you're having. One, we want to validate them today by saying that we feel that way too, and two, that you're not alone. So thank you for sharing the way that you've been feeling over the past 17 months with us. Yeah, they're still coming in.
Okay, so we are going to ask you a question. Of course, this is anonymous. A few questions. So number one, have you considered leaving your job due to your mental health? Number 2, have you ever considered utilizing mental health resources, whether it's within your workplace or anywhere else? Number 3, do you feel that mental health is valued in your organization? And number 4, do you feel that your mental health has a direct effect on patient care? So you can vote yes, no, unsure. If you aren't able to access, again, you can type into the chat if you feel comfortable.
We'll just give it a couple seconds and talk about the results so far.
So we're seeing so far, a lot of you have considered using mental health resources, and you do feel that your mental health has a direct effect on patient care. We feel the same way.
Yeah. We do see that some of you also have considered leaving your job due to mental health. And we do see that in terms of a no, and I guess it looks like it's kind of somewhere in between. What would you say, Sarah? Like somewhere in between the green here?
Yeah, the mental health, it seems like it's going either way right now.
Yeah,
So
in terms of the value that you might feel that mental health is put on in terms of your own organization, it almost looks like it's 50-50. So yes and no, so kind of moderate. We feel the same way too. So I want to talk a little bit about the pre-pandemic levels in terms of how nursing has been feeling before the pandemic. And really, we already know that we've already been burning out. This is actually not new. And I'm sure that you as nurses, we are tired of hearing this term, this phrase, but it is true. It rings true that we're already burning out. And again, like I said, this is not new to nursing, but the pandemic has actually indeed made it worse. We talk about the nursing shortage. It's a chronic problem. It's something that we need to talk about and we actually need to deal with as well. We always, I don't know about you guys, but when we were nurses on the front lines, the majority of our shifts we worked short. There's always, I think it was few and far between that we had a shift where we had a full complement. We were always surprised when we're like, oh my God, everyone's here today. That's amazing. But working short is something that happens all the time. There's a lot of disempowerment in nursing and in our profession. Sometimes we don't feel heard, respected, or even valued. Again, nurses are told to do more and more with less and less. That's something that we've been seeing over our entire career trajectory in nursing, that we're doing more work with less resources. And also the bullying, harassment, incivility, and gaslighting is huge in our profession. It's a huge hurdle that we need to work on. We need to openly discuss and deal with it. And that's also part of the reason why nurses are burning out. And then we are seeing that nurses are quitting and leaving the profession. So what does some of the research have to say? So we found that the Journal of American Medical Association had done some studies. In the findings, they did a cross-sectional study where they took data from over 50,000 nurses in the US, representing more than 3.9 million nurses nationally, and found that among nurses who reported leaving their current employment, there was, and this was about 9.5% of the sample, 31.5% reported leaving because of burnout in 2018. There also were some reports done by nurses.org that looked at the results of a national nursing engagement report. And this report was based on survey findings from over 2,000 nurses. Again, reported large feelings of burnout. It was actually rising over % of time of nurses feeling unengaged. It was about 41% of nurses feeling that unengagement. And again, they also explained that some of the effects that unengaged nurses may have. So they may not feel that they're a part of the care team. They will have diminished morale. Like we're seeing this all across the board. And also just feeling emotionally checked out from work, which ultimately can affect patient care. We also did some research in terms of some Canadian statistics released by the Canadian Federation of Nurses Unions that talked about mental disorders and symptoms among nurses in Canada. And this was actually some pre-pandemic data that was found. And what they found was over 1/3 screened positive for major depressive disorder and suicidal ideation, more than 1/4 screened positive for generalizing anxiety disorder, and PTSD symptom rates were consistent with those for public safety personnel. So firefighters, police, and EMS. But we also need to focus on retention, educational incentives, flexible scheduling for nursing, representation of nursing as a profession. Organizations also need to support nurses for room to grow and opportunities for growth. So if a nurse has identified that, they want to, learn more about quality improvement or learn about other initiatives, organizations should be making that a possibility for frontline nurses as well. We also need to talk about autonomy of practice, nurse-to-nurse ratios and patient ratios, better collaboration within the interprofessional and interdisciplinary team, staffing resources, and just building better relationships overall. There's so much work that needs to be done, but we have to talk about it to get to the next stage in terms of seeing better healthcare outcomes, not just for our patients and families, but for the nurses that are working there taking care of patients and families. Next slide, please.
So now we're going to talk a bit more about what nursing has been like during the pandemic. So some research that has come out of Canada shows that healthcare workers experience high levels of stress, anxiety, and burnout under normal conditions, which we know, and the pandemic has only made a bad situation worse. So a research that was conducted at McGill University last year interviewed 64 nurses and 55 physicians. The results indicated that among the respondents, half of the nurses and 1 in 5 physicians expressed an intention to quit their job. It also found that although nurses and physicians recognized there were services available to them, such as counseling services, only about 10% of those had actually used this resource. So there's a gap between what we're looking for and what's available. And, it may be due to a variety of factors, but really the resources available or maybe not very available to us aren't meeting our needs. There was also a research study done by the Registered Nurses Association of Ontario. It was called the Work and Wellbeing Survey. And this actually got responses from over 2,000 nurses, and it has a 95% confidence interval. So we can be sure that the results are valid. Nurses generally felt very concerned about health risks related to COVID-19. They felt that the pandemic has really affected their work-life balance as a nurse. They felt moderate to very high stress levels, and only a minority, so about 26%, had taken time off to manage stress or anxiety as a result of working during the pandemic. We know that also nurses in their mid-20s to mid-30s are already leaving in elevated numbers, which is very concerning. These are nurses that are not taking early retirement. These are nurses at the height of their career, leaving for various different reasons. And it actually suggested departures of up to 13%, which is about 4 times the rate prior to the pandemic. So we know that also compared to physicians, nurses used a lot of what we call maladaptive coping strategies. I think we've all vented to one another about issues that we have felt strongly about. And that may be due to the lack of power that we feel. But often venting isn't the best strategy. They suggest things such as positive reframing. There are a lot of different ways that we can try to cope better, and we'll go into this in a little bit more detail in the next few slides. Next slide.
So what should the role of the employer actually be at this point in time? And what is the role of the organization that you might be working with? I mean, one of the things that we feel that the employer should be doing is they should be supporting the workers. So they should be supporting you as a nurse. And what does this actually look like? So some organizations have preventative care models. They may have wellness programs. They may have, a variety of different things, but does that bring value to you? Is that something that, they have come and said, hey, do you guys find this resource helpful? So they may have it, but it may not be something that's helpful for you. So again, this is another opportunity where you as a nurse can talk to your organizations or say, hey, this is actually, as much as you guys have this type of wellness program, there's something that might be better suited to us. So we could do this through whether it could be done through a poll, a focus group. I think a focus group would be better. But again, making sure that nurses are a part of the decision making that actually impacts you. The other part that I think organizations can do to help support nurses is to actually have a plan or support in place for returning to work if you actually do go off on mental health stress. I cannot stress this enough. Between myself and Sarah's own experiences, a lot of the policies and procedures they have in place do not reflect mental health and do not reflect mental health supports. When we were going through our own struggles, they would give us functional forms to fill out, which doesn't necessarily help in terms of, what you might need in terms of accommodations to going back to work. Knowing whether I can lift a 30-pound box isn't going to necessarily help if the condition and the reason I was off of work was mental health. So we need to push organizations to have better accountability and better structures in place to look at mental health in terms of including that into their return to work plan. Again, also a culture of no shame. We in healthcare, we should be doing such a better job at dispelling myths, breaking down barriers when it comes to talking about mental health. There was nothing but shame that we felt when we had to approach our employers, when we had to retell our stories over and over to various different people about, whether it was returning to work or trying to explain the impact of mental health had on us and our return to work plan. So again, I think organizations need to do a hugely better job in terms of decreasing that shame. Like, we're all healthcare professionals. I think that's another point that we want to really pull out. And then also just talking about the mental health benefits. So in that video that you guys watched, there are many organizations that have really poor benefits for mental health. So here in Canada, we've even seen as low as $200. That really can't get you a lot of mental health support here, specifically in Canada. So just for a preliminary, assessment, that could be up to $175. There's your $200 gone. If they feel that mental health is something that should be treated, it should be treated just as if I was to break my leg. It's the same type of thing. Just because you can't see it doesn't mean it's there, doesn't mean it should be valued at any less. So organizations really need to step up in terms of having better mental health benefits and just really putting their money where their mouth is. That's something that we really want to see. Again, we talked about Starbucks Canada. I mean, they're doing a great job. $5,000. Again, another insurance company we looked at was Manulife. That's another Canadian company. $10,000. We need to really step up what we're doing in terms of supporting mental health, because we know that mental health is actually health. Next slide, please.
So we've talked a lot about the struggles. I think everybody understands that for the most part. Now we want to talk about how you can actually move forward. So from a personal level, we want you to realize first and foremost that you are not alone. This isn't a struggle that you need to face alone. There are many different supports out there. Some of the things you might want to do is recognize symptoms in yourself. So do you feel that you are sleeping more or less? Have your eating habits changed? Do you feel like you can't shut your mind off, that you're constantly thinking about what's happening at work or worried about what's going to happen at work? Do you have difficulty concentrating, or have you been really short with people in your life? Do you not enjoy the things that you used to enjoy? Are you having panic attacks, or are you continuing to feel hopeless and desperate? So some of the other things might be constantly, feeling guilty, making it really, it's really difficult for you to make decisions. Sometimes it can be different. You might not recognize this in yourself, but if someone close to you has mentioned this to you, it might be worth looking into. And if that's the case, you might want to reach out to a mental health professional and also know what your rights are. So we all have the right to mental health support. If you are undergoing mental health treatment, that is confidential information, and you only need to share what is necessary for your employer. And that varies depending on where you work. As a first step, you might want to start by reaching out to a trusted friend or family member if you know anybody in your life that has gone through mental health struggles, just to see what their experience has been. And also do the same for others who you feel may be struggling. We all need to support each other and work as a team.
Yeah, I'm just gonna actually jump on that as well. I think the checking in is so important. I mean, one of the things that we've seen is, I actually saw this just recently, where there was a picture of, it was like Robin Williams, Anthony Bourdain, a whole bunch of these really great celebrities, of them all smiling and happy. And I mean, Instagram and Twitter and all these various different things are all the rage now, where, you can paint the picture of how people think that you might be feeling, but knowing deep down inside that may not be what you're actually feeling. So again, doing those check-ins, and I think those check-ins are hugely important. And I think sometimes that, even myself and Sarah, it's easy for us to be like, yeah, hey, how are you doing? And then just go off with oh, I'm okay. But really, really check in. Just be like, I know it's been stressful. Tell me about it. Open-ended questions are always really good, as opposed to yes or no types of questions. And just really opening the conversation and not being afraid to say, do you feel suicidal? Do you feel hopeless? Do you feel majorly depressed? And then knowing you don't need to know all of the resources, but you just need to know how to point them in the right direction to getting that help. So checking in on your friends, your family members, your colleagues, hugely important as well.
Right. And one other thing, as nurses, Amy and I are women, we're mothers. We often have a really hard time saying no. So one of the things I would suggest is learn to set boundaries in your work and your personal life. So, saying no to that extra shift or that overtime, take time to enjoy your hobbies on your day off. Call a friend or family member just to say hi. I think making connections in this day and age is really, really important. And give yourself permission to do nothing on your day off. I say nothing in quotation marks because if you have small children like myself and Amy, that's not always possible. But, don't do any housework for a day. Go off of social media. If the news is causing you anxiety, don't read anything for a whole day. And, eat that cake and binge watch Netflix. You have permission.
Yeah, trust me, oh my goodness. If I was to step on the scale, I know I ate the cake. It's okay. It's fine. This is unprecedented time. Like this is unlike a time that we've ever experienced. I think we're to think back to when the last pandemic was, it was over 100 years ago. And I think they talk about pandemics coming every 100 years. So this is not something that is normal. So it's okay. Eat a cake, whatever your fancy food is, binge watch whatever shows that you like. I think I did a little bit of Bridgerton. I mean, find what works for you and really just take the time that you need. Next slide, please. Oh, yeah. So how do we move forward again? So community is also important. So know what is happening in relation to politics and healthcare, especially when it comes to understanding mental health. We have probably urged our governments, written many letters, calls to actions, all sorts of various different things to push our government to include mental health as a priority, as a part of the plan in terms of what we want to see change. Advocate for paid sick days in your region. This was actually something that was really huge out here in Ontario because we saw the disparities that the pandemic has revealed. I think that was one of the things that we noticed a lot, that we noticed that marginalized people, racialized people, these were the people that we're seeing in our ICUs, factory workers, people who are precariously worked. And the reason why they tended to be more sick was because they didn't have the time off. So, they would go into work. They might have a child where they're like, I have to send this child to school because if I don't, I don't have the flexibility or the time to support them. So we've been advocating for paid sick days. Again, here they're talking about getting rid of it. But again, we're in a fourth wave, and I'm sure that you guys are in a fourth wave as well. We need to continue to advocate for paid sick days because we know that people who are pushed to the fringes, so people who are marginalized, people who are racialized, women are hugely impacted by the pandemic. We need to push for things that we know will make a difference. Again, we need to advocate for more mental health coverage. I can't stress this enough. Like I said, $200 is not going to get you anywhere. We need organizations to really step up and put their money where their mouth is and actually add finances and financial resources into mental health and mental health supports. Know who your politicians are. So here in Canada, we have MPPs, but in the States and in various different places, you might have governors or whatnot. Knock on their doors, send them letters, Twitter bomb them, IG follow them, just get the word out there, and then also get involved with, there are probably groups that are actually doing some of this work as well. know who those groups are in your communities, reach out to them and say, how can I be a part of this movement? How can I be a part of the solution? Because I think a lot of the times, we understand that there's a problem. We can point out the problems. Nurses are really good at that. We're like, there's the problem, there's the problem. We also need to be solution focused. We need to be a part of that solution. And that's actually advocacy and getting out and saying, hey, we need to do better. And I'm going to march, and this is going to be a part of my passion in terms of making sure people are held accountable to do better. You can join a professional association. So there's a variety of different associations that we've involved ourselves in, and also just search them out. There's so many good people out there doing really great things. I think that's also a really great thing that you can do as well. Again, donate your time to help and support causes. So whatever your passion, your love is, if it's specifically mental health, if it's advocacy, get out there and join a group. I can tell you just from our podcast, from being able to have this opportunity to speak to you guys, we feel that we're doing something. I think sometimes we feel so disempowered. It's just like we can't do anything. We can't change the system, but you can't change it if you're not going to be a part of it to make that change. So I urge you all that's listening today, find your passion, find your love, and donate your time to support causes that are worthy to you. Next slide, please.
So how do we move forward, knowing that we're really in a time with a pandemic? There are still areas that are, under isolation, and we're not seeing people face to face like we used to. Take to social media. So one of the ways that we've really gained traction with the podcast and as advocates is getting active on Twitter, on LinkedIn, Facebook. These are really great avenues for connecting with other nurses, other healthcare professionals, and really amplifying their messages. So we've been able to do that. And sometimes we might not think we don't have the time, but I always think about how much time am I spending on Netflix? I could be doing something productive at the same time. I could be on social media and watching Netflix at the same time. So I think it's really about trying to carve out small moments of time throughout your day. It doesn't have to be, a whole long hour of doing anything in particular. If you're willing to get out there and go on TV, radio, write an article for the newspaper. They are begging for nurses at the front lines to give their perspective. I think there's been a long history of shame and silencing within nursing for various different reasons, but if you're willing to do it, we really need authentic voices to be out there. We don't want other people speaking on our behalf.
Yeah, that happens all too often. How many times have you guys watched a news report where a physician is talking about nursing shortage? I mean, it makes no sense, right? I think we should be the ones that talk about what's happening within our own profession. So I can tell you Twitter is a force that really is amazing, because you can drive so much social change through there as well. The other option is LinkedIn. I mean, at first I kind of scoffed when I was like, join LinkedIn, what's all that about? And it's actually a really great network to learn about other healthcare professionals, to kind of see some of the innovations that might be happening from like an organizational and also just like a global standpoint. It's also another way to connect with other people within the workforce that are looking for different ways for change, and just, building your own CV and your own resume.
And I think that us starting our podcast was a way for us we tried to bring our concerns to management, didn't go anywhere. So we decided to create our own platform. And, starting our own, also being guests on other podcasts has really opened the door. And, if anybody's interested in how to do that or how to be in the media, Amy and I we're happy to share what we've learned. And, just follow and engage with the healthcare community. The reason we picked the name Gritty Nurse Podcast, we get asked this a lot, is because we wanted to show that we are strong. We are a strong profession. We've overcome a lot. We continue to overcome barriers. We really just need to show the world what we can do and how diverse nursing is as a profession.
Yeah, and the other piece that I'm going to throw out there is always to make sure that you follow and engage within the healthcare community with respect, with honesty, and with grit. So we are passionate. We know what things that really keep us up at night. So whether it's talking about mental health, anti-Black racism, anti-Asian racism, whether it's talking about women's health or women's rights or health equity. These are things that, and nursing as a profession, these are things that, we want to talk about, we want to engage the public with. And I think that we're best suited to talk about these things. And I think a lot of people say, nurses, should stay in their lane, or, nurses don't have the education. I think that is not true, and that's unfounded. We need to reshape the image of nursing, and we could do that by one post at a time, but always engaging in respectful discourse. I think that's always the way to go. And I mean, you could challenge people's thoughts and opinions in a respectful way, but you could do it also in a very great way as well.
So now we're just going to open it up to the group. This is the end of our formal presentation. If anybody has any questions at all, feel free to ask us. You can type into the chat. We'll be happy to answer any questions that you have.
I want to thank you for sharing all this great information with the group. We do have some questions and some comments. The participants have been very engaged with your presentation. So one person in particular, she said, I get so mentally exhausted halfway through my shift and cannot give what I want to my patients. What do you guys think about that? Do you have any tips or tricks or ways to help her rejuvenate?
Yes, sir. Well, I would say first and foremost, don't beat yourself up too much, because we are really in a really difficult time. And I think this is where you need to look around at your colleagues and see, can you support each other in any way? Is there a way that you can get through the shift? I always used to mentally count down the hours in my head. So one great thing about nursing is that once you clock out, you're out. You don't have to bring the work home with you. So I think it's just a matter of finding different tips and tricks to get you through the next few hours or however long that might be, and know that you can't be everywhere and do everything. One of the things about nursing is there's always more that you could do, but you're only one person and there's only so many hours in the day. So just try to think of it that way.
And the other piece I'd probably like to say is, I think that we sometimes forget that we are in a team environment. It's okay to ask for help. Know who your person is, know who your support people are, and it shouldn't have to be anyone specific. But at the end of the day, there's no point in drowning. Ask for help. And the thing is, again, I think that it's okay to do that. And again, it's about patient safety, best patient outcomes while you're there. And if you're feeling that you're overwhelmed, you're drowning, please ask for help. I mean, I think you'd be surprised with, hey, can you help with this and other? So of course, absolutely. So if you can, ask for help. And then, if you find that every shift is like that, maybe you need to take some time to yourself as well.
Perfect. Thank you for those answers. Excuse me. What about travel nurses? Do you think travel nurses are getting burnt out too? Or is it better that they get to take some breaks in between their work assignments?
That's a great question. We have not travel nursed ourselves, although we've been in touch with a lot of travel nurses. And I think there are a lot of perks with travel nursing, such as the pay, but you really do have to hit the ground running when you get there, because the reason they hired you as a travel nurse is they need you to fill the holes in the system. So I think with travel nursing, it's easy to be burnt out because of the environment that you're in. And you really have to be okay with change and get to know people quickly. Once you know who you can rely on, I think that's the most important thing. And once you get into somewhat of a routine, it might get easier. So I think there are a lot of actually online resources out there for travel nursing. If you were able to connect with that community, they could probably provide you with a lot of suggestions on how you can tackle this.
And we actually spoke to a really great travel nurse. His name is Hugh the Nurse. And he kind of gave us the insider's look. And again, like Sarah said, they give you the worst of the worst of the worst. And the heaviest load. But also know your scope of practice, because that was the other thing that he really pointed out to us. He's like, know your scope. They can't give you something that's outside of your scope. And if they do, really know your contract, so you know your provisions in terms of what you can and can't do. Because, for example, one of the things he said, he's like, I'm not a labor and delivery nurse, but they tried to send me there. And it's just like, know your rights, know what your scope is and what you can work within. And again, just say, that may not be acceptable. That might not be an acceptable assignment, because at the end of the day, always bring it back to patient safety and patient outcomes. If you know that you're not going to be working safe, you need to let the employers know. And if they say we can provide you training, that's a whole other thing. But they need to make sure that they give you the tools to make sure that you're safe in your job. That's for sure.
Wonderful points. Thank you for sharing those. We do have a couple questions about connecting with you after the webinar. So people want to know how to access your podcast, The Gritty Nurse, and then also if you feel comfortable, how can they connect with you outside of the podcast?
I think the easiest thing is to go to our website. It's grittynurse.com. And from there, you can fill out a contact form if you wanted to connect with us directly. We're also, like Amy said, we're active on Facebook, Twitter, Instagram. Which other one? Did I say LinkedIn? Yeah, and so in terms of finding our podcast, you can listen directly on our website, or if you already have Apple Podcasts and you're listening to podcasts there, you can find us. Also Spotify, Google Podcasts. We also put all of our podcasts on YouTube. So if you're not a podcast listener, you can definitely start by listening to ours. And I think we try to discuss issues that we are affected by and that others are affected by. And we always want to amplify the voices of those who traditionally haven't been able to, get the attention they deserve. So you can find us all of those ways. You can also email us. It's grittynurses, all one word, @gmail.com.
And I guess you're probably better at this than I am. So our Twitter handle is @GrittyNurse.
Yeah.
Our Instagram handle is
Gritty Nurse Podcast.
Oh my gosh, I should know this.
And on LinkedIn, I think it's just linkedin.com/grittynurse. And on Facebook, I think you can find us pretty easy.
Yeah, we have a
Facebook page as well as a group.
Yeah, we do have personal handles as well. So if you want to find us personally too, my personal handle is @AmyBarley on Twitter, and Sarah's is
@SarahMFung. And if you just go to our Twitter Gritty Nurse profile, you can find us
all
there.
All of our personal handles
as well. Yeah.
Very good. So the next question is kind of a hot topic, I think. And I know that in my personal group of nurse friends, it has come up several times. Do you recommend a person should share their diagnosis of depression with their nurse manager?
Okay, so I'm going to start this. So it is a hot button topic. This is where I would say that, really when it comes to your mental health and it comes to, anything that's regarding your health, whether it's an underlying chronic disease or illness, you actually don't have to disclose those things to the employer. Again, if it comes up as, like, let's say there was a concern where you had a panic attack or you have a major depressive disorder and you're taking medications or whatnot, your employer doesn't actually have to know your mental health status. They don't have any rights to knowing about those specific things. Again, that's something that you can let them know if you want to, but it's actually not their right to know. So if you actually had to go off of work and it was due to mental health stress, it actually doesn't necessarily go through your manager. They should be notified by the occupational health department that you're taking leave, and they're not privy to what that leave entails. It could be surgery, it could be because of mental health, but again, I'd say that's a personal choice. I'll tell you from my personal experience, my previous manager, and I hope I get this right, it was my previous manager actually did disclose that I had mental health issues and concerns, and she was not supportive.
Right, and I also want to add that your diagnosis is personal health information, so you do not need to disclose it, and all your employer really needs to know are if you have any limitations.
Right.
So if there are limitations in terms of your hours or the patient load that you can take, or if there are any things that you can't perform. And when they get those limitations, whatever they may be, your diagnosis is not part of it. So again, I think it's highly dependent on the situation and the culture of the workplace, but you definitely don't have to disclose if you don't feel comfortable.
Yeah, again, this is one of the things that we are like, not just us, but many people are working on, is really decreasing that stigma, right? I mean, at the end of the day, we should be caring, compassionate, and understanding. But the flip side of the coin, the reality is not everybody is. And then in these types of situations, I think, I don't want to say it's a gamble, but again, in terms of knowing your rights, you don't have to disclose your personal health information to your employer.
Those are excellent points, and I really do appreciate your guys' honesty when it comes to answering that. I know, I've had friends that did disclose, let's say that they were changing their depression medication and were worried about how their affect would be or how they would
Right.
interact. So they went ahead and notified their nurse manager, and then later on, the nurse manager did use it against them, saying things like, you should do this because I'm concerned about your mental health. You do have depression, et cetera,
Wow.
et cetera. So obviously those are not appropriate, but this is the truth and the reality of it. Like Amy said, it's the stigma, right? That still, and even we have leaders that aren't quite on board yet, right?
Yeah.
So we do have a question, and this seems like it's a pretty vulnerable question from one of our participants about being an older nurse over 60. It seems difficult to obtain a new job, affecting her mental health, and she feels she's not good enough. Any suggestions for her as she's job hunting? She feels that she's being categorized as an over-the-hill nurse.
Okay.
Yeah, that's unfortunate because I think in nursing we value years of experience so much that it shouldn't matter. But there are, on the other side of the spectrum, there are nurses that have been discriminated against because they look young or they don't have enough experience. So I think that it's a challenge, but at a certain age, you have so much experience, you have so much to give. I think we as nurses, we often engage in a lot of negative self-talk. So we convince ourselves that we're not worthy of applying for a position or securing a position before we even start. And I've seen this a lot throughout doing the podcast, is we often reach out to nurses to come on our podcast, and they've got more experience than us and they don't feel confident. So I think it's really about being confident, knowing what your strengths are, amplifying those strengths. You have so much to give that I think any employer would be lucky to have you. And it really depends on what you're looking for, what your priorities are. There is a job out there for you.
Yeah, and I'd like to say first, I'm sorry that it sounds like you're being discriminated against by your age, and I hope that that's not the case. But again, just I'm sorry that you're experiencing this. And I think what Sarah rings true, right? I mean, I think that continue to apply, and then maybe even try, maybe like if it's not just the bedside, there's other opportunities in nursing as well, whether that might be in public health or in schools or various different things. So maybe even just broaden what your applications and what you might be applying to. But again, know your worth, and we're going to root for you too. And I hope that you do find something. And if, for example, let's say you did get an interview and you felt that there was some discrimination related to your age, I would call it out.
Mm-hmm. And this is where Amy and I talk about getting on social media, because I really think that's a way to market yourself. Mm-hmm. So versus
LinkedIn profiles.
LinkedIn, I don't work for LinkedIn. We don't have any affiliation with LinkedIn, but I really feel that nurses all need to get on LinkedIn because it's a really great way to put yourself out there. So instead of applying to 100 jobs, you might even have recruiters reaching out to you based on your LinkedIn profile, the skills that you've put on there. So I think that would be one suggestion I would give. Just try to get started, see where you can get, and it's really where everyone is moving to.
Very good. Thank you for answering that. The next question is kind of long, but I do think it's something that you could speak to and have some information for this participant. She says, I am a nurse practitioner who owns her own business, so she feels like she is never, quote unquote, off. I cannot shut my brain down. I exercise every day. I eat healthy, sleep from 9 or 10 p.m. until 6 a.m., but I am always exhausted and cranky or sad. I've cut back on my hours this month, but my patients are upset. Should I post on my website or social media pages why I am needing to cut back for the month of September to help my mental health?
So first and foremost, I'd say you don't have to explain anything to anybody, but that's just my take. I think, I think people are much more understanding too, that if you're just saying, you're taking time to recuperate, or you don't even have to use those words, but taking the time to, reset, whether it's like reset some things within your business, and maybe even giving them an opportunity or a resource in terms of like, if they can't see you, they can see someone else. I think that might be helpful too for the month of September. But again, I think taking care of yourself is so critically important, because at the end of the day, you're not just a nurse, you're someone's loved one. There's other people that care for you. And if you can't take care of yourself, you can't take care of your patients. So again, I would just reset that focus and make sure that you take care of yourself and take the time that you need. Maybe it might be more than a month, maybe the month will do the trick. But again, just take care of yourself. I think that if you are still feeling that, you're getting the sleep that you need, you're getting the exercise, and you're still feeling that you're burning the candle at both ends, then something's going to give and something needs to change. So I think that taking the time that you need is really actually a value and of importance.
Yeah, and just to build on what Amy said, this is a really healthy way of setting your boundaries. So
Yes.
you're not trying to push through because your patients need you. Your patients will be there even after you take your break. I'm quite sure of it. And so really this is you exercising your right to maintain or set boundaries. And this is something Amy and I have to do daily because, we have full-time jobs, we have families, we have the podcast, I have a side business. There are only so many hours in the day. And if your battery is completely out, then you can't help anybody. And sometimes it feels wrong, right? Like as nurses, we're taught to care for others. We're taught to advocate for each other or advocate for our patients. We're not taught self-care or how to, advocate for ourselves. So it's a skill that we need to learn and practice all the time.
Yeah, you can't pour from an empty cup, my mom would say. So make sure that your cup is filled before you try to fill others. Put that, just like on an airplane, put your mask on first.
Before your
passengers.
Yeah.
I love your mom's quote. So she seems like a very smart lady. And to speak of putting your mask on first, a shameless plug for our webinar number 2 in this series was actually called Put Your Mask On First. So that ties very well. We're almost out of time, but I think this last question deserves a little bit of attention. And then we'll go ahead and close up after you answer this how you see fit. So much of the time, nurses work around psych healthcare providers they may seek treatment from. What are the ways they can make that relationship feel safe, confidential, especially in small communities?
That's actually a really good question. And the first thing I'm going to point to is patient confidentiality. Like at the end of the day, that patient provider relationship, it has to stay confident and it has to stay confidential. I mean, again, I think physician practitioners or whomever else that you might be seeing, they have huge rights where they have to keep your information confidential. And I know it must be harder when you're in a small community where you might bump into that healthcare provider in the grocery store that you might have divulged some really important information to. They have to keep that information private. I mean, that's where that trust has to be built and that respect has to be built. And again, if you're not feeling that, I think that might be time to see a different provider.
Yeah, and I can understand the feeling of, in a small community, you think everyone knows your business. But if your provider can hold up their end of the bargain and you can hold up your end of the bargain, meaning if you see each other in the hall, you keep it completely work related, don't mention anything about the treatment you're seeking, I think that's one step. And as Amy said, if it warrants finding another provider, I think that's okay too, because right now a lot of psychiatric care is taking place virtually, so you're not constrained by location. You can really, go outside of your community if you have to.
And again, I guess if you feel that confidence has been breached. So for example, let's say, you were talking to whomever at the grocery store and you get a vibe or a sense that, that your health information was breached by the care provider. There are reporting boards that you can report them to, because confidentiality is huge. And again, if that information has been disclosed, I would take the time to actually report that care provider to the board if they have breached your confidentiality.
Thank you so much. Now, unfortunately, we did not get to all of the questions, so I would recommend that the participants reach out to you like you explained through your website, grittynurse.com. I want to thank you so much for sharing your expertise and all of this great information today. We are grateful that you took time to share with our audience, and we look forward to hearing more from you in the future. We hope you enjoyed this webinar. As a reminder, 1 week from today, we will email you a link to complete the evaluation for you to obtain your continuing professional development certificate. Be sure to check out Sigma's upcoming webinars, podcasts, and resources to support you and your colleagues at sigmanursing.org. Also, previously recorded webinars and podcasts are freely available on the Sigma repository. Thank you so much for joining us today, and have a wonderful day.